I'm the Columbia chief here at NYP, and I'm here on with Will, who's our Cornell chief. Um,
Hey everyone.
Sorry I look like this. I'm a little sick, but I'm happy to be here and help answer any questions. So I'm going to start with just a brief overview of our rotation and clinical sites, and then we'll kind of talk about the more special aspects of our program. Um, So just a broad overview, we really look for leaders in the field. We really focus on innovation and really building a comprehensive training. And our two main clinical sites are, so we're New York Presbyterian is kind of the broad organization that we're employed under, but they work with these two institutions at Columbia University here upwards in like Washington Heights area, and then Weill Cornell in like the Upper East Side. So those are our two main clinical sites where we spend the most time. And do our main inpatient rotations and most of our outpatient rotations as well. One of our slogans here is stay amazing, and we've consistently ranked up high in the top 10, especially in the New York City hospitals. Um, just an interesting photo collage here of our department leadership. Dr. Stein is our chair. Our current PD is Dr. Visco. And then you're also kind of working under Dr. Singh at Cornell, whereas Dr. Visco has more of a presence at Columbia. And then we have multiple faculty, which we won't get into too much, but lots of faculty. So we have 8 trainees every year, total of 24. We're a categorical program, so everyone kind of does their own intern year and comes together. Not everyone does their intern year in this city. Some do it in California, upstate New York, or wherever. We also have a lot of fellows that we work very closely with. We have 2 sports medicine fellows, PEDS fellows. We recently, as of last year, started our NAS fellowship, so we work closely with them as well. And then we have a lot of exposure to all the fellows at our affiliate sites, which I'll go over, including Hospital for Special Surgery. It's the #1 orthopedic surgery hospital. MSK, Memorial Sloan Kettering, which is the cancer hospital. So we work closely with the fellows across these areas as well. And I'll kind of go over the clinical sites. So again, our main ones under the umbrella of New York Presbyterian are Columbia up in the Washington Heights area, and then Weill Cornell Upper East Side. So we'll spend most of our time here doing inpatient and then outpatient with our attendings at these sites the most. This in the coming year or so, there may be some change with Columbia campus potentially migrating to Brooklyn as well. And that's just a change that's relatively new. So within a year or two, or if you guys are coming in, we might have migrated to the New York Presbyterian Brooklyn site instead of the Columbia site. But you would still be doing most of your outpatient exposure at Columbia, and it would still be a main training site. Other clinical sites, we do have a lot of them. Hospital for Special Surgery, also very like 1 block from Cornell. Memorial Sloan Kettering Cancer Center, 1 block from Cornell as well. And then we have some, standalone sites. Helen Hayes is where we do spinal cord injury as a PGY2. And then as a PGY4, you go back to doing brain injury inpatient there. And then Blythedale is a standalone children's hospital where you get our pediatric inpatient and consult exposure. And then as a PGY4, you also go to the Bronx VA to get more spinal cord injury and inpatient exposure there as well. So there is an aspect of commuting. Most of our sites are accessible via the subway. We have shuttles from Columbia to Cornell, so it'll take you direct campus. And we do offer a lot of reimbursement for transportation. So when we go to Helen Hayes and Blythedale, there's like a taxi that picks us up. We'll get like $1,000 in transportation coverage while you're at Helen Hayes. And there's an apartment up there if you want to stay up. It's like an hour and a half commute from like Manhattan, Cornell area. So there are those things. Some people drive every day as well, just not as common. So that's kind of the breakdown of how much we spend at the sites. And then just kind of diving into more inpatient or the direct individual sites as well. So Columbia, currently 16 beds. There's 2 residents. There's a PGY2 and a 3. We also have a PGY3 doing consults. So it's kind of the 3 people in the room on the inpatient side. Again, this might change and we may be moving to Brooklyn in the coming year or so. And then we do a lot of our EMG electrodiagnostics, mostly in our final year as fourth. That's where we spend with the neuro department doing our electrodiagnostics. And then Neurologic Institute is just where outpatient clinics are as well. And then as you can see at Columbia, these are attendings that are employed by Columbia. So there are a lot. And through these attendings, you can work with them at mostly the Columbia campus, but they can be working in Midtown. They could be working at our new Spiral, which is new outpatient pain clinic at Hudson Yards. So it's a really nice clinic there. So sometimes you'll be sent there to do rotation. So you have to be really adaptable and really you're all over Manhattan for the most part. But these are a lot of the faculty that you can work with. Of course, there's our pediatric rehab. Dr. Roberts actually just started, but Dr. Azizi is kind of the main person at Columbia, and then Dr. Jones at Cornell. And then you'll have more once you're at Blythedale as well. Same thing for Cornell, Dr. Singh, who's very famous in the pain world. He's kind of the vice chair here. You're also doing inpatient, outpatient, and consult rotation at Cornell as well. It's an inpatient unit and we have 22 beds. And there's 2 residents again, one PGY2, one 3, and then a consult resident who's a PGY3 as well. Same thing for outpatient. When you're in your outpatient rotations, you can be rotating with any one of these attendings, almost all of them actually. And so you'll be kind of mostly at the Cornell location. We have a special spine and fluoro suite location. So
Chris, I think we lost your volume.
really? Hello? How do you
We
lose?
we can hear you okay.
Okay, you can hear me?
Yep.
Sorry,
Oh,
it's on my end.
So then, and yeah, and we, through New York Presbyterian, you can also, we're kind of looking to get into the Brooklyn sites as well. And the Queens attendings, we don't really work with, but definitely an avenue that we grow. There's no paucity of attendings and clinical experiences. And there's attendings that work in very niche things, pelvic floor, pelvic pain, very specific things. So I think that's really what sets us apart. Again, more neuro rehab as well. And then just overall schedule considerations, we do 6 to 7 week blocks. So you're on the same rotation. When you're on inpatient, you're there for 6 weeks. So that really gives you a good chance to get familiar and get really good at something. So you might be on inpatient 6 weeks, then you might go to outpatient and you're doing some calls overnight and then clinics every day. So you really get to get into the groove. And then the main thing is as a 2, we kind of get you exposure to everything. And then as a 3, you have a selective block, which is a 6 or 7 week block where you're
Okay. Yeah, your volume did cut out a little bit there.
okay. Should I repeat it? Everything I said? What?
Like maybe from the last 15 seconds.
Okay. And as a PGY3, you have a selective, which is an elective block where you get to choose the attendings and whoever you're working with. And then as a 4, you're really kind of solidifying, interviewing, working on wherever your next step is. And then I'll pass it over to Will.
All right, so Chris, I'll give a great overview already. Hospital for Special Surgery is one of the affiliate sites that we rotate at. This hospital is right next to the Cornell campus, so very close by, and this is solely outpatient, kind of sports and interventional spine medicine. I think it's a great example of if you conceptualize what private demics is. HSS kind of is probably the number one for that. They have great didactics and um, but still they have a very robust outpatient practice as well. So you can kind of see both sides of how they kind of triage patients and still use evidence-based medicine. There is three sports fellows and one NAS fellow here. So either those specialties are something that you're interested in, you work pretty closely with those fellows as well. Memorial Sloan Kettering is the number 2 cancer hospital in the country. We do our cancer rehab rotation here. So this is as a PGY2 and a PGY3. You come back for another rotation. You kind of get a mix of outpatient and consults here. It's kind of nice. There's no like disposition consults, so it's a lot more management considerations. And then with Dr. Custodio, who is kind of the head of our department here, you can also do EMGs as well. Helen Hayes, again, is where we do spinal cord injury rotations as a PGY2 and then TBI as a PGY4. These are both inpatient rotations. I think, nice to kind of see what a freestanding rehab experience is like because obviously at the flagship Cornell and Columbia campuses, those are all ingrained within major tertiary care centers. And yeah, you can also get opportunities to work with prosthetists and orthotists on site, kind of look at adaptive technology, communication, and sports. And then Blythedale is where our inpatient peds exposure comes from. This is as a PGY2. I think you saw Dr. Tanalia on a previous slide. On a previous slide, she is the main point person for our rotations here. And, a great experience to see what inpatient peds rehab is like, also at a freestanding rehab hospital as well. And then finally at the VA, we get our VA exposure as a PGY4. This is also primarily inpatient, but also some outpatient exposure too. I think kind of a mix of SCI and, kind of the classic musculoskeletal exposures. We do have a couple other opportunities as well, depending on your interests. So one is the global health track. Dr. Eisen, who primarily is inpatient at Columbia, and then Dr. Guillaume, who is a sports medicine doctor at Cornell, are the two main point people for this. You can join the track as early as your PGY2, PGY3 year. It kind of consists of, learning what global health medicine is, conceptualizing different projects and essays of, different elements of rehab care that you would conceptualize if you were to design your own global health rotation. And then upon completion of that track, if you want to, we're affiliated with the Bugando Medical Center in Tanzania, and you can travel there for a couple of weeks to work with our affiliates over there as well to really see the global health in person. So that's probably our main track. That's also, by the way, in association with, I think, University of Colorado. We're kind of partnering with them to help, uh, kind of do a dual campus type of curriculum. But there's also different tracks we have. Sports is very popular in terms of fellowship choices that people go into from our program. So we have a more tailored kind of like extracurricular track. Basically, it involves everything that you would need to apply for sports fellowship. Kind of helps you get involved with sports coverage opportunities, research, etc., attendings to get your letters of recommendation. There's also innovation tracks if you're interested in designing wearables, and then I think like other things as well, lifestyle medicine, administration, peds.
It was just a 5-minute warning.
Cool. In terms of curriculum, I think this is probably pretty standard across different programs. We have our core lectures. We have didactics every Thursday morning. And then, this will involve kind of campus-wide grand rounds. We'll have some anatomy sessions to get exposure to ultrasound. And then we have, a lot of opportunities for journal clubs. research, QI projects. In terms of ultrasound, so we basically break it down to the major large joints in the body. So we'll have roughly 6 to 8 sessions where there's going to be either a fellow or an attending that leads a session, and then we'll take a couple hours for each session just to practice ultrasound on each other, learning how to do a pretty comprehensive diagnostic assessment from a musculoskeletal standpoint. And then we have some opportunities as a PGY3 and 4 to do injection practice on cadavers during these sessions too. We're affiliated with Cornell and Columbia, 2 Ivy League medical schools. So we get a lot of medical students that rotate. If teaching is something you're interested in, you'll definitely have a lot of opportunities with that. They rotate with us both on our inpatient and outpatient rotations. So definitely lots of connections there. And then sports medicine, we provide sports coverage for the New York Marathon and the Columbia athletic teams as well as Fordham. St. John's actually was recently acquired by HSS, but through our affiliation with them, if you're interested, you can cover St. John's sports as well with their fellows. And other things that we do is we cover the rugby teams in New York, the Battery Park Dance Festival, and then there's a Velocity charity ride that we do annually as well. All right. In terms of mentorship, just really quick, we kind of get you set up into smaller pods. There's like a PGY2, a 3, and a 4 who are connected together with a faculty member at the beginning of your residency. And that's a support group for you if you have questions about, fellowship, just issues with residency in general that you want to troubleshoot. But I think we're pretty open. So if you ever have questions you want to talk to faculty about, definitely feel free to reach out. All right, I think I'll try to skip through really quick. Yeah, I think definitely opportunities to go to conferences, you know, perks of living in New York City. I'll leave to you guys to imagine. You don't really have to worry about living expenses, at least in New York, which is nice. We have a pretty good salary. Our scale this year as a PGY4 is like 122,000, all things considered. And then as Crystal said, there's different transportation credits as well. All right, and then talent show is a fun thing that we do. But yeah, I think we're running out of time. So thank you all for attending our presentation. And if you have any questions, I guess you can ask them really quick or just post them in the chat. We can stay on for a couple of minutes.
Does anyone have any questions at the moment? All right. There are a couple in the chat. First one is, can you elaborate on the call schedule?
Yeah, are you okay if I answer this on the speaker, or would you want me to just type it in the chat if the next group is about to
Yeah, you
go?
can just answer it right now.
Okay. Yeah, so the call schedule, it's mostly as a PGY2 and a 3, and a lot less as a 4. But again, Crystal mentioned that Columbia's inpatient unit is getting downsized in a couple months. So that's going to basically eliminate the call on the Columbia campus. So it's about to be halved. Before, it would be like a little bit more complicated. You would do kind of like weekday calls when you're on the outpatient blocks, and then Saturday calls when you're on the affiliate sites. And then on your inpatient rotations, you would do a alternating Sunday day versus night call. But now that Columbia inpatient unit is being downsized, that's going to probably be replaced by a Brooklyn Methodist hospital rotation instead. And you would take call basically one weekend, I think, a block on that rotation. So if you imagine kind of what I just said, but cut it in half, that's I think what we're picturing. But it's honestly kind of a actively evolving change. So TBD.
Right. And I'm sorry, unfortunately, time is up. So we do need to move on to the next program, but there is one more question left in the chat. If you wouldn't mind responding there. But yeah, thank you so much, both of you, for taking the time to present tonight.